Welcome to the To Your Health podcast, your go-to source for everything health, wellness, fitness, and the latest in medical insights. I'm your host, Rhonda Alford, and joining us today is Dr. Logan Ledet, a board-certified infectious disease specialist at Terrebonne General. Welcome to the show, Dr. Ledet.
Thank you so much for having me.
Well, let's get started with you telling us a little bit more about yourself and your role at Terrebonne General.
So as you said, I'm an infectious diseases specialist. So what I tell patients is that means I help out with complicated infections and antibiotic therapy, or helping out figure out if an infection is actually contributing to what's going on with the patient.
Well, we have an interesting topic we're talking about today, something you say that's pretty prevalent in our community, and we're talking about Vibrio. So let's jump right in.
Okay. Vibrio is a bacterial infection. It is a gram-negative rod, which is a description of how it looks under the microscope, and it helps us identify it as clinicians. And it can cause very serious and sometimes life-threatening infections, particularly common in our area because it lives in salt and brackish water, which we encounter often through both our recreation and our commercial activities and livelihoods.
How do people typically become infected with Vibrio?
Two ways. They can consume the bacteria, so raw or undercooked seafood like oysters, and it can cause a usually self-limited GI illness, so nausea, vomiting, diarrhea. But if it gets into a wound or is introduced through an injury, it can cause a very serious wound infection called necrotizing fasciitis.
Okay. And how should someone protect themselves in a marine type of environment if they do have a wound?
One is knowing your risk for the infection. There are quite a few risk factors that increase the chances of this becoming a very serious infection for you. The number one being liver disease. Also diabetes or immune compromising conditions such as cancer, or if you're on immune modulating therapy for an illness. If you have one of those risk factors, ideally we avoid the water in the warm summer months, but sometimes that's just not possible. So things like, if you work in the water, you have to go to work regardless of what's going on otherwise. So things like wearing gloves to protect your hands to minimize the risk of injury, or if you're going to be contacting the water with an open wound, keeping it clean, wearing a waterproof dressing to protect from water getting into the wound are good measures to take.
And what are some early symptoms that someone might be able to look for or telltale signs?
So if Vibrio gets into a wound, the telltale sign is that it will get very bad very quickly, essentially. It is very, very painful. Patients will describe it to me as a burning, searing pain that extends beyond the wound. So someone might have a small puncture wound on their hand, but they feel a burning that extends far up their arm. The wound becomes necrotic looking very quickly. So again, a small puncture wound will develop a large blister, a lot of redness. And the pain with touching it will be out of proportion to what you look at on your hand. So very, very, very sensitive to touch.
So when you say necrotic, explain what that means.
Sure. So necrotic is dead tissue, essentially. So necrotic tissue appears black or bloody. So we'll call them hemorrhagic bulla, or a blister on your hand or near the wound that is filled with blood. And then the tissue again becomes dark, black, kind of dusky looking.
Right, so that is not normal.
That is not normal.
Sees that. So when should someone seek medical attention?
When in doubt, get checked out for sure. Vibrio spreads very quickly. So necrotizing fasciitis is commonly called flesh-eating infection or flesh-eating bacteria. It spreads very quickly. So you should go to a hospital and get checked out if you are at all concerned that you have this type of infection.
And how is the Vibrio infection diagnosed?
So necrotizing fasciitis or flesh-eating bacteria is a clinical diagnosis, meaning the person who is seeing you needs to know what's going on to act appropriately and quickly. There are tests that help confirm that. We'll sometimes use imaging to understand the extent of the tissue involved. When a surgeon goes in or we get a culture of a wound, if this bacteria grows, obviously it would be diagnostic of this going on, but all of those things take longer than, treatment should be initiated before those tests even come back. Prompt care is very important.
And what treatments are available and are they effective?
Treatments are very effective. So with any infection, the most important thing is what we call source control, or removing what is infected to the best of our ability. So while we do use antibiotics, I usually use a combination of 2 antibiotics, ceftriaxone and doxycycline. The treatment for this is largely surgical. So our surgeons will go in and clean out any infected or dead necrotic tissue, and they will continue to go back into the wound usually every other day until there's only healthy tissue left. At that point, I usually treat with antibiotics for a week to 2 weeks after their last operative intervention to make sure that any residual infection is gone.
Can Vibrio infection be life-threatening?
It absolutely can be. Unfortunately, last year was a particularly bad year for Vibrio infections across the Gulf Coast, but particularly here. What we usually see statewide, both in cases and deaths, I saw just at Terrebonne General. So I saw multiple people pass away from this infection last year. I saw multiple people with very serious wound infections who ultimately ended up losing a limb because of this. So that is why prompt care is so important. Surgical intervention when the infection is still in a relatively limited area will help save both your life and your limb.
So it's important to take the precautions, the preliminary precautions you spoke about.
Absolutely. Being smart in the water. If you get a wound, clean it with fresh, clean water, and protecting any exposed wounds that you may have.
And what are some common misconceptions about Vibrio?
I think common misconceptions are underreacting to it and getting a delay in your care. So I think a lot of people, every time pretty much that I've treated someone for this infection, they almost always know someone who's had it. So people know it exists, but they kind of think, oh, that's not what's happening to me. And they wait a day or two to come into the hospital. And even that day's delay can be a significant impedance to effectively treating the infection as being as effective as we could.
What should they look for? I know we talked about the telltale signs, but you're saying like it's so important to act immediately. Like immediately, what would someone feel or see or can identify?
The redness and any blistering around the wound that would develop quickly, and then the pain will be very bad. Yes. So yeah, if you have a little cut or scrape and you're like, wow, that really hurts more than it should, and it happened because you got scraped with a crab trap or pinched by a crab, or you were shucking an oyster and got yourself with a knife, come into the hospital.
And are there certain times of the year where this Vibrio is higher? You see a higher incidence rate?
Summer months, so warmer water is more conducive to the bacteria growing. Okay. I think something about last year, the water temperature and the salt levels in the water were just ideal for the bacteria to grow, and then you had a lot more cases.
So why is Vibrio so dangerous? Is it in the food if you haven't ingested something, or the wound?
The wound is usually the bigger issue. Okay. And again, if people ingest it and eat it, it still can cause serious life-threatening infections in people who have things like severe liver disease. But wounds are the more severe infections that we typically see.
And who is at risk for these infections?
So liver disease, I brought that up a couple of times, specifically because our liver helps regulate the iron in our bodies. And if our liver does not function properly, we can end up with an overload of iron, relatively speaking, in our blood and in our tissues. And iron is essentially food for certain bacteria, particularly Vibrio. So if someone has liver disease, so things like cirrhosis, untreated viral hepatitis, autoimmune hepatitis, if they drink alcohol every day in excess of 1 to 2 drinks a day, or any combination thereof, you're at risk for this being a very, very serious infection, both eaten and in a wound, but particularly in a wound.
How can people enjoy seafood, and reduce their risk to getting Vibrio?
Cook it.
Yeah, those raw oysters.
We all love our raw oysters, but sticking to cooler months, being mindful of how the oysters are harvested and grown, because there are safe practices with those things. But in warmer months, in the summer, cooking oysters, fried oysters are just as good,
Yeah.
Maybe not for your diabetes, but fried, charbroiled, cooking things through.
Yeah, making sure they reach a certain temperature and get
Exactly.
hot. So what precautions can be taken when swimming or wading in coastal waters?
Again, knowing your risk factors. If you are at risk for serious infections, liver disease, poorly controlled diabetes, a compromised immune system, avoid the water to the best of your ability. It's really genuinely not worth it. If you do go in the water and you get injured, again, clean this cut or scrape as quickly as possible with fresh, clean water. If it's unavoidable to go into the water and you have a wound, even like a surgical incision or a cut or a scrape, wear waterproof dressing to avoid the salty water from getting into it.
Does this typically happen to a young, healthy person?
No, but exceptions are true. The youngest person that I've seen with this at Terrebonne General was 36 years old and did not have too many other conditions. So it still can happen. And it was a wound to his hand, and he needed extensive surgery to his hand and his arm to save his limb. So it still can happen. Again, a misconception being that, oh, it won't happen to me. If you get an injury and you're like, that doesn't look right, that doesn't feel right, it hurts too much, even if you are young and otherwise healthy, come in and get checked out.
Yeah, never hurts to play it safe.
Never hurts to play it safe.
Well, what is the most important takeaway you would like our audience to know about Vibrio?
We're going into the summer months. We're going to be out in the water. Just be mindful that it exists. Again, if you're concerned about any injury that you get checked out. If you eat raw or undercooked seafood and you get ill and that nausea, vomiting, diarrhea persists longer than a day or so, come in and get checked out.
So don't ignore the warning signs. Pay attention to your body.
Absolutely.
How can someone schedule an appointment with you?
Well, first, if you think you might have Vibrio, go to the emergency room. Second, I'm a referral-based office, so your primary care provider or a doctor seeing you for another condition, if they're concerned that an infection is contributing to what's going on, they can send a referral to me or reach out to my office and we'll set up an appointment.
All right. Well, thank you so much for sharing this helpful information. Hopefully it'll save a life.
I hope so.
Well, thanks for being with us.
Thank you again for having me.
For more information on Vibrio and Dr. Logan Ledet, visit tghealthsystem.com. Don't forget to like, share, and subscribe to our podcast where you get your podcasts. Thanks for joining us.